Ndine Mwaiwao zeto ndifuna tikambirane pang'ono ubwino wakuyuza ma inhaler. Ine namba kafukufuku wa asthma 2019 ndikuyamba yamba ndi oxygen, anandikapa oxygen. Ndinezovuta kuti ndilowe pachoti ndimaopa ndimona ngati inhaler amapha. Ndimene Malawi timaziwira kuti inhaler ndoyipa. Koma nditalowa kafukufuku uja naona zoti ubwino poyambirira ndimajomba ku sukulu, sindimatha kusewera ndi anzanga, mwina ntchito pakhomo sindimatha kugwira, koma panopa mmene mukundionera ndine wathanzi, ndimasewera mpira wa miyendo wamanja, china chilichonse panopa ndili bwinobwino. Panopa mmene weather ilili makhala kuti mwina ndalowa kalekale ndabva juzi, koma panopa ndi zinthu zabwinobwino. Nde ngati kuli kotheka ndifuna ndipemphe kuti pali anthu ena ake sanalowe kafukufuku, koma zikuyeneka kuti Malawi ine aliyense mwana zimufikire chifukwa ndi zinthu zochepa. Pali ena ake timakumana nawo akudandaula, koma ngati kuli kotheka anthu ena ake afikiridwe mukafukufuku. Ineyo ndi Mwaiwao ndamazo.
Mrs. Kalimu kuchokera kusochikwale ndinalowa nawo kafukufuku wa asthma chifukwa kuti mwana wanga amadwala mphumu. Kafukufuku amene ndapindula naye kwambiri chifukwa kuti poyambirira mwana wanga sanalowe kafukufuku amadwala kwambiri. Ndimapita kuchipatala pafupi kumakalandira mankhwala amapilisi komabe sizimathandiza. Komano ntangolowa kafukufuku wa asthma ndikuyamba kundipasa mankhwala a inhaler kuyamba kungwiritsira ntchito mwana wanga, ndapindula naye azimayi anzanga. Chonde ngati muli ndi ana anu amene akudwala mphumu, mwina anthu ena amatha kumakuwuzani zosiyanasiyana zokhuzana ndi mankhwala a inhaler molakwika. Ine ndifuna ndikusimikizireni azimayi anzanga kuti mankhwala amenewa ndi abwino ndithu othandiza. Pamene mwana wanga anangoyamba kulandira chithandizo, moyo wake unasintha. Ku sukulu samajombanso pano, koma nthawi yambuyo amajomba. Nde ndifuna ndikusimikizireni azimayi anzanga kuti mankhwala a inhaler ndi abwino. Ngati tili ndi mwana wathu chonde tithamangire kuchipatala. Zikomo.
I am Beatrice and I'm a senior research nurse at Malawi Liverpool Wellcome Trust. I have been working as a research nurse for over 15 years. I have been involved in so many projects concerning the lung health. I'd like to share with you the challenges which asthma patients face when they go to different hospitals. Asthma is treatable, though there is no cure for asthma. And the people suffering from asthma face so many challenges. For example, for them to access the inhalers is very difficult. The problem with these inhalers are that they are usually found in the central hospitals. They are not locally found, they are not locally available. So it's very difficult for people to go and access these inhalers. They have to walk for long distances to get the inhalers in the central hospitals. And the other challenge attached to inhalers is that there are so many misconceptions about inhalers. Those people in the community who use inhalers, some people laugh at them, and there are so many things talked about inhalers. They say inhalers kill. So when people hear this, they easily become discouraged. So that is a major problem here. And another challenge is that the inhalers are expensive. It's very difficult for people to buy the inhalers because of their high price. But all in all, inhalers are good because they work instantly. Apart from that, there is knowledge deficit in the hospitals and in the community. There is a gap. Most of the people do not know how to use the inhalers, and they don't know how to manage their asthma. So for someone with asthma, these people face so many challenges. And even the health workers, some of the health workers are not aware on how to manage asthma and how best to use the inhalers. The proper technique for using the inhalers is not there in the community. So that is also another big challenge. Another major challenge on the asthma patients face is the late diagnosis of asthma. Children are given antibiotics and other drugs thinking that it's something else because of the knowledge deficit among health workers. Children keep going to hospitals and they are given different drugs. The health worker doesn't think about asthma. By the time they think of saying that it's asthma, it's too late in that person's life. Then there's this other challenge about asthma education. Asthma education is a very important aspect of asthma management. But now, unfortunately, in the health facilities, people do not have enough time to explain what asthma is and how to go about it, how to get the treatments and how to use the inhalers. People seem to be busy with other things. They don't have the 30 or 45 minutes to explain to participants on how to manage asthma. So this is a very big challenge, because if you don't tell people what to do with the drugs, it's really a problem, because they will end up doing the opposite of what you would like them to do. Although asthmatic people are given inhalers at the hospital, most of them end up not using them at home. They opt for traditional medicine, and for this it becomes very difficult for the asthma symptoms to resolve. So this is another major challenge the asthmatic patients face. I think they opt for the traditional medicine just because of the so many misconceptions which are in the community, and maybe the family members discourage them to use the inhalers, and like that they would always go for the traditional medicine because it's maybe the influence from the community and the family members. It's very important that people should know what triggers their asthma, because that is the only way they will know how best to manage the asthma. There are some triggers like changes in weather, dust, exercise, as well as smoke, which can trigger asthma symptoms. So if people know how to protect themselves or how to prevent these things, it will be easy for them to control the asthma.